Welcome to Your Voice Must Be Heard podcast. I'm your host, Marquita McGee, a happy wife, proud mother, career woman, and voiceover artist. I created this podcast as a place to be encouraged through wisdom for different aspects of life. We all navigate through the many challenges of life, feeling unfulfilled in our purpose, and we believe there's more. We will explore in this podcast keys to unlock the door to the next level and transform. I'll be interviewing people who have found unconventional wisdom that catapulted them to success in business, health, relationships, and their gifts in the arts. We will reflect on how you can apply unconventional wisdom to achieve your success, affirming what you believe and helping you create your transformation story. Come along with me into this week's episode to capture this wisdom and have forward movement in your life. In part 2 today, we're going to dig a little deeper into the nervous system and spine and figure out how they both work together to produce signals throughout our bodies to function. We're going to talk about the nervous system and how it gets overwhelmed due to stressors we face on a daily basis, physical symptoms, and how chiropractic care focuses on root causes to eliminate health conditions entirely. We're going to look at experiences from pregnant women to children and how to tackle two of the most popular health challenges in America, obesity and heart disease. Take a listen. You've kind of told us the importance of chiropractic care. I think, we tend to think of it about the back and the neck and the pain associated with it. But you've just told us why it's imperative that it become part of our preventative maintenance for our health. I also, in my research, learned that you said, it's really about the nervous system. So can you expound
Correct.
a little bit about that?
Well, what we have to understand is this. The central nervous system, which is your brain, the spinal cord, which is a cord that goes all along your spine, and then the nerve roots, so the nerve roots of the spinal nerves, those make up the central nervous system. Those are in charge of controlling and regulating every single function that takes place in the body. Everything you think, feel, or do, nervous system controls that. In order for the heart to beat, nervous system controls that. In order for you to be able to move your arm, nervous system controls that. Okay. In order for you to digest the breakfast from this morning, nervous system controls that. Okay. It sends the signals for the body to produce the chemicals and all the different processes in the body. In order for your body to heal after a surgery or after an illness, nervous system still controls that. Your spine just happens to be the protective mechanism, okay? But what happens is this: we also have to bear in mind that the extremities are extensions of your spine, okay? So, your feet, your legs, your arms. So say, for example, you walk off the curb and twist your ankle slightly. What's going to happen is for maybe a day or maybe a couple hours, you're going to walk with a little bit of a limp. Okay. So when you're standing, the base of your spine are your feet, but by you walking with that little bit of a limp, it's going to affect, the knee, and it's going to affect the hip. That's where the true base of the spine is. So that imbalance there is now going to create an irritation to that spine. Okay. But the thing that happens is, because the spine is very flexible, it's been designed to be maintained from an early age. Okay. So because of that flexibility, it becomes susceptible to different forms of stress or trauma. So we have physical stress, a slip, a fall, an automobile accident, the position that we put ourselves on a daily basis at work, lifting objects incorrectly, strenuous exercise, lack of exercise, not getting adequate rest. Okay. Then we have chemical stressors, things that we ingest on a daily basis, pollution, contaminants in the air, contaminants in the foods that we ingest, the excessive consumption of, foods with a lot of preservatives, or basically a lot of junk food, alcohol, cigarette smoke, even medication, because they're artificial chemicals. They have a time and a place, but they're still artificial chemicals. And we also have emotional stress, fear, anxiety, anger, worry, and depression. So we have 3 different stressors, and, the body doesn't distinguish between one stress or the other. And a lot of times, either it could be something recent, but the majority of the cases is just something that's been accumulating over months or years. Okay, the body just knows stress. So the brain, the body is controlled by signals or instructions that the brain is sending. So the brain is communicating through that spinal cord. In between each one of the vertebrae, the spinal nerves now ensure that the signals that are going to your heart go to your heart. The signals that are going to the front of the arm go to the front of the arm. Signals that are going to the butt muscles go to the butt muscles, and so forth. Now, these signals are supposed to go to all parts of the body, and they're supposed to get there without any interruption. The issue is this: when you're constantly stressing the body and you're not giving the body the proper tools for it to be able to recover, that nervous system becomes overwhelmed. And when it becomes overwhelmed, now the body loses that ability to respond to that stress. Basically starts bringing out that white flag. Okay. So what happens in the process, that's when those receptors are triggered. And as a protective mechanism, just like a circuit breaker, things will shift. And when they shift, what happens is they're trying to protect the area, but in the process, they also irritate the nerves. Okay. So when that nerve or those nerve fibers are irritated, that's going to alter that vital signal or those vital signals that the brain is sending to X parts of the body. Okay. The longer is there, those areas that are responsible for getting that proper nerve supply, now those areas are functioning deficiently. And by functioning deficiently, eventually the body gets to a stage where you have more traumatized cells than healthy cells. And that's when a symptom is going to show up. Okay. And a symptom is anything abnormal in the body. Okay. A headache is a symptom. Constipation is a symptom. Not getting adequate rest. Those are symptoms. Neck pain, back pain. That's just your body saying, look, there is a problem. I need attention. I need help. Okay. Now, our focus as chiropractors is not necessarily that symptom. Okay. Why? Because in order for that symptom to appear, two things must occur first. First, you must have a cause. And that cause could have come from 2 years, or it could have come from 20 years ago. Okay. That cause gives rise to a condition, which is where the body is basically finding the best ways to adapt, because we have to understand the human body is a self-healing, self-regulating organism. Okay.
Yes.
And that might be there a couple years. It might be there a couple months. And eventually that condition will manifest a symptom. So by the time the symptom shows up, we are already in the third stage of a problem. Okay. Now, typically, what's the very first thing that's going to disappear? It's a symptom. But the issue is, because we live in such a cosmetic society, whatever was ailing us, when that disappears, we automatically assume that, okay, I must be better. The problem is that a lot of times we go back to doing the same things that got us there in the first place. Okay.
Yeah.
And some of those things might be unbeknownst to you. Okay. So our job is not necessarily to treat the symptom, but rather, okay, look to see where are these areas of imbalance where that relationship between the spine and the nervous system is not functioning properly, and then give the body the ability to function again and heal on its own terms, okay, rather than trying to go treat a symptom or a condition. That's not the job of the chiropractor, okay? Yes, we will adjust and people will feel better and all of these different things, but sometimes you have to understand that whatever triggered that symptom might have a lot of underlying different things. And that is the reason why at times we have to adjust people with a little bit more frequency and a little bit more time, simply because we now have to start retraining the body, reprogramming and re-educating, because the body has learned a certain pattern or a certain position or a certain movement, and we have to change that pattern gradually so the body now starts functioning better. And therefore the body is going to deal with whatever it is. Unfortunately, sometimes we allow the body to go way too far beyond what it could do on its own, and that's when you need that intervention. But if we're talking about health and well-being, okay, we always have to understand the importance of the spine and the nervous system, simply because that is in charge of controlling and regulating all functions that takes place in the body. So in order for the other things to function adequately, we have to also ensure that that nervous system is functioning properly.
This is good. So, chiropractic care helps our bodies to function better by tackling not just the physical symptoms we have, but actually drilling down to the root causes. And you said all of that starts within the nervous system and spine.
Mm-hmm.
In my experience as a patient with chiropractic care, my quality of life improved during my time when I was pregnant. I was using chiropractic as a preventative maintenance and for the health of the baby. Towards me getting to that 40 weeks, my medical practitioner had said the baby was breached. I remember coming to your clinic, you assessed me with your uh, techniques and the tools that you use, to help align my body and to get it back in the proper place it needed to be, and it corrected the issue. I believe when I went back to the doctor, my OB, he had to do minimum work,
Amen.
and the baby turned around and got into position to get ready to, for me to go into labor and delivery. And it was a successful labor and delivery. And so chiropractic care contributed to my overall health as well as the health of my baby. And so I want to thank you for that. Thank you.
And funny that you should mention that. Last week, Monday, I am headed to the airport, and one of the athletes that I've worked with for a number of years, that's pregnant, uh, sends me a text, and she says, "Can I see you this afternoon?" And I said, "Well, I am on my way to the airport right now." And she says, "Oh no." And I says, "Well, I've got my table in the car. I can come by and adjust you." And she says, I'm like, she's like, "Oh, that would be great." And I said, "Send me the address." And I head over there. I, checked her out and I adjusted her, and I, went about my business. Okay, caught my flight, and then I'm gone. 2 days later, I get a text. It said, the baby came. And I said, "The baby came." I said, "Oh my God." She said she was so relaxed. And when I went over there, she was scheduled to have a C-section. Okay. What happened was, that night that I adjusted her, she started getting contractions, and later on her water broke. She went to the hospital, and the following morning she had the baby. Okay. And the baby came vaginal birth, natural birth. Okay. Which I was so happy. So, and I was, because I was like, "Oh my God, they're gonna do a C-section." I was hoping that that will not happen, but we were able to adjust her, and by taking the stress off the pelvic area, baby was able to put herself in the proper position. And she went there, and she said she was 3 hours in labor. I said, "You're lucky." So, you know how many women will be happy for 3 hours of labor? Yeah, so that's another great story. Yesterday I had the opportunity, went to adjust the baby and the mother.
That's similar to my process. I mean, the labor and delivery was quick, just like that. Within a few hours, I had my baby. So, for mothers out there, soon to be mothers, add chiropractic care to your preventative plan. I'm telling you, you won't go wrong with it. So, we know it's beneficial for adults. Let's talk about children. What are some of the challenges when dealing with pediatric patients? How have you improved their quality of life through chiropractic care? Do you have a story for that?
Oh, absolutely. I give you my ex-wife. Like, when we started dating, um, she had an 18-month-old. Okay. And one day, when I went to pick her up, we were going to go out, and uh, you know, he was part Tigger. You know, he was always jumping all over the place, but this particular day he was just sitting on the sofa, just very, like, almost, listless. So, I asked her, "So what's wrong with Sterling?" And She says, I don't know. So he calls him over. He says he has a fever. He says, okay, I'm going to give him a Tylenol. So right away I jumped up. I says, please don't put that garbage in your child's body. She says, what am I going to do? I'm not leaving here with my child sick. I said, let me give him an adjustment. And then she says, an adjustment? What is that going to do? I'm like, yeah. I'm saying, let me adjust him. So I laid him down on the floor, checked his low cervical spine, and the adjustment that you give a child is different than you give even a baby versus a 2 year old versus a 5 year old. The adjustments are a little bit differently. So I lied him down. I adjusted him. A minute had not passed, and he was up and running. And typically kids will respond a lot quicker. To be honest with you, I had been in practice for a couple of years, but I'd never seen anything that quick. So I stood up and I said, "Wow, that was fast." So I went to talk to her, and she said, "What did you do to my child?" She had an attitude, and I said, I gave him an adjustment. I said, that's what I did. So then I started to explain to her what was happening, and I said, he's also dehydrated. He needs to start drinking more water. The story behind this was that he had bronchiolitis, okay, which is one step before full blown asthma. And every day she will have him on a nebulizer so he could breathe, and the medicine in the nebulizer will geek him up. So sometimes she didn't want to do that, so she'll be in the letting the hot shower, the steam, open up, allow him to breathe a little bit better. But what happened from that one adjustment that I gave, and obviously I adjusted him through the rest of his life. That one adjustment that I gave him, never again did he have to go on that nebulizer. Okay. And the history is he was when he, the part of the history is when he was born, he was a big baby. He weighed 9 pounds. So, even though it was a natural birth, studies show that the first trauma to the spine sometimes is the birth just because of the twisting and the pulling, and it could create little misalignment in the very delicate bones. And by giving him that one adjustment, his body was able to respond. And Sterling is, hasn't, he's 28, and he hasn't had, drugs in his body. His body just responds, very well. So the challenge with the pediatric patient is, you got to make it fun. So one of the things I tell them is like, okay, look, I'm gonna, when you hear the little cracking sounds that's done when you adjust, it's just gases that are being released from the joint capsule, not bones that are cracking. So sometimes what I joke around with them. I ask them about when's the last time they had some popcorn. I says, I bet you I could find some popcorn, and depending on the size, I could pick them up and just kind of apply a little bit of pressure in an area, and I say, oh, you see that was a popcorn. So that way I'm able to calm them down, and just make them feel comfortable. But I've had kids where they for whatever reason they get freaked out, and I tell the parents, no, don't worry about it. Don't worry about it. I said, I won't do anything. Or sometimes I take an instrument and do a couple of things. And I have another funny story is a patient that mom, dad come get adjusted. Her older brother, which is 5, and she's 2, and she would never want to get adjusted by me. So one day she comes in with the dad. She was having some issues. Caught some things from some of the kids at school. She's having some issues and things like that. And next thing she comes in with the brother and the dad, and the dad is like, he's getting up to come and get adjusted. She stands up. She said, "No, I want to get adjusted first." So now she's getting adjusted first. So you have to gain their trust. You have to gain their trust, and if it means not adjusting on that day, or just saying, "Hey, just give me a high five," and that's it, and you just do a quick evaluation. No, you don't want anything, no problem, until they get comfortable. That way they're able to receive that adjustment a lot better. And what happens is they grow up, okay, uh, with healthier habits rather than having to take medication and things like that.
Again, these are great stories to really show how chiropractic care helps everyone, whatever stage of life you're in. For the children, it makes them function better and potentially eliminate childhood disease.
Right.
Okay, two more questions here. Obesity and heart disease are number one and number two health challenges faced in America. What are some tips from a chiropractic perspective for our listeners that are struggling with obesity or heart disease?
Well, obviously, we have to pay attention to our eating habits and the things that we're putting into our bodies. Because if we put in junk in our bodies, that's what the body's going to utilize to try to function as best as possible. We have to become a little bit more active, and but one of the things that happens is sometimes people have gained so much weight, and there's that all of that weight gets placed on the joints, so it now becomes a little bit difficult for them to decide, okay, I'm going to go for a walk, okay, or I'm going to go for a little jog or something like that. The muscles start aching and things like that. So what and what happens is, prior to or in the process of gaining all the weight, some imbalances occurred, and those imbalances contribute to that all that weight that's added to their bodies. Okay. And what, from a chiropractic standpoint, what we're doing is helping to take some of that stress all in some of these areas, and therefore allow them to perhaps go out and maybe walk a little bit, and or one of the things that I suggest is like, okay, so if it's difficult to walk, start in a pool. One of the best forms of exercise is just water aerobics. So they could start easily walking inside of a pool. That way, they're not putting any stress on the joint, but they're still creating the mobility. And we also have to bear in mind that the there were a number of bad habits that got them to that point. Okay, so doing one thing one day is not necessarily going to start correcting those things, but it's a habit now that you have to now start creating, okay, in order to allow your body to be able to perform and be able to now start dropping the weight. Very important also hydrating, because a lot of times as what we chronic dehydration, we realize is like, oh, I'm hungry. What is your body dehydrated? Basically, not allowing you to, giving you that hunger sensation, but it's actually the dehydration. Your body's letting you know, okay, I need more fluids. I need more fluids. I need more fluids. So you start with the hydrating. You start with your eating habit. Start with fasting. That's another important aspect. That's how your body detoxifies. So there's a number of things that people can start doing gradually. What happens is we get tired of doing the right thing slowly, and we want we've been programming basically a microwave society. We want we want instant changes. When the state that we're in didn't occur overnight, is not going to change overnight either. That's like planting corn today and expect to pick and eat it tomorrow. That's not going to happen. Okay. It's the same thing is, okay, we got to be gradually making one change here, another change here, another change here. And eventually we start seeing little victories and little victories. And those little victories eventually become a huge victory.
Okay, so we have some steps here. We need to correct our old habits or reverse our old behaviors. And as we're doing that, we need to allow our bodies time to adjust. So we need to have better eating habits, be more active. And then, having a chiropractor will allow us to eliminate some of those stressors that having an active lifestyle, particularly for people who are obese, and try to create better mobility and hydration. So these are some good tips. So what do you want to leave as a legacy for your children? You have a set of twins yourself, and what do you wish for them to gain from your life as a world-class athlete and world-class chiropractic specialist? What do you want them to know, and what do you want to leave with them?
Well, I want them to, what I want to leave with them is that they know that I was the best father possible. They're around me when I'm working with the athletes, and they see the things that I'm doing, and I tell them, those things are important, and I do it because I have a passion and I love doing that stuff. I said, but at the end of the day, to me is how good of a father I was to you. What kind of values I instill in you. So I try to lead my life where they could see positive things. Okay, and if I make mistakes, I say, hey, I opened my mouth and I said, please forgive me for this. I did this wrong. Okay, but understand. Okay, you're going to make mistakes, but I am telling you what I did was wrong. I don't want you to repeat those same mistakes. And sometimes you have to allow them to make their own mistakes, so they have their own learning experience. But we don't want them to clash their head every step of the way. If I can teach them correct, proper values, and obviously, or bringing them up in a biblically based environment.
Yes, this is great. Being the best father and leading with biblical principles is a key to success for our young ones. Great. So, where can people find you for chiropractic care or athletics training?
Well, my website, athleticsdc.com. That's ATHLETICS D as in David, C as in Charlie.com. That's my website. You could put information there, and whenever I get a chance, I reach back out to you, or you could either text or call at 678-591-7245. Those are ways to, and I'm always open to answering questions and this and that. It's going to cost you absolutely nothing if you have a question or an issue that's going on, and I could give you some positive advice, without giving you tips or things to do, but kind of guiding you and telling you, okay, this is possibly what's happening, or no, this is something that requires a little bit further evaluation, whether it be from me or from another specialist. The same on Instagram, athleticsdc.
Dr. Marco Belizaire, I want to thank you so much for your time today. It was such an informative and educational time that we had here. I feel like when I come to your office, your clinic, it's always an opportunity to get educated and improve my health. So thank you.
You're welcome. My pleasure. My pleasure. Absolutely.
Thank you so much for listening to this episode of Your Voice Must Be Heard podcast. I hope the story you heard inspired and motivated you to take action for transformation in some aspect of your life. I would love it if you send an email with questions, share your enlightening moment, or profound wisdom you may have. You can also connect with me on Instagram at Your Voice Must Be Heard podcast. I look forward to hearing from you. See you in the next episode. Bye.